That is the genesis of our strike. And as I speak right now, all the issues we went on strike for, lack of proper equipments, human resource, the doctor-patient ratio in Kirinyaga is 1 to 30,000. We only have 6-7 consultants, that is one of each. WHO recommends one doctor to 1,000 patients. You can see that one doctor in that county is working for over 30 doctors. And still, salaries don't come on time. They have not been promoted in 10 years. They are not taken for postgraduate studies. That is specialized studies. In Kirinyaga, we get a lot of patients with head injury. We have doctors who applied to go and do neurosurgery, but they were denied. They were denied. No specialization is happening. 3 doctors went to school to pursue their postgraduate studies, but they were unprocedurally fired. We wrote letters asking the county why they were fired. We never received back any communication. And I'd like the Honorable Committee to note that since 2017, all the communications that we have done through the union, none of them have been answered. Even the dispute, the labor dispute that we registered with the Ministry of Labor was not responded to by the county of Kirinyaga. So as I speak right now, I have never had a chance to sit down with the CEO of Kirinyaga County and discuss health matters at all. Even when we had informal meetings, we used to be stood up. So I can say openly that in health, we need to feel leadership, because health is not a matter of joke. When a patient dies, we cannot recover that. And when the specialists in your county, the people whom you have hired to take care of your health, tell you that indeed people are dying after surgery because the linens we are using on them have blood from other patients because the autoclave is not working, the governor should take it seriously. When we say that the hospital kitchen is dirty, the drainage is terrible and is causing hospital-acquired infection, the governor should take it seriously. When you employ a specialist and you don't take their advice, you're doing a disservice to yourself, to that person, and to community in general. Thank you.
Just to clarify some issues, you spoke about the shutting down of some dispensaries, yes?
Yes.
Are you aware who might have authorized the shutting down of those dispensaries?
Yes, we were told that order came from the CEO of the county, citing lack of funds to run the health facilities.
I gather you to mean the CEO, the governor?
Yes.
How many dispensaries were shut down?
Over 30 dispensaries.
You know the reasons as a regional representative why they were shut down, and are they in operation today?
They are not in operation. We even have a letter from the public health officer in Kirinyaga who did a letter to the governor telling the governor that the dispensaries are dilapidated, the grass is at the level of the hip, that is where pests like snakes are roaming around in the hospital. For example, Kebembe Hospital, we have incidences of snakes entering the theater. When the doctor wants to operate, first you have to be a snake wrangler so that you can finally take care of your patient.
Dr. You spoke about the issues of the casual workers who were fired, yes?
Yes.
What time were they fired? Before the strike or after this, during the subsistence of the strike?
During the subsistence of the strike.
Had the strike been declared illegal by the Labor and Relations Court?
No.
Could you be knowing whether the governor was involved in the firing of the said casual workers?
Yes. Yes, and there's even a public statement to the same effect.
Who made the public statement?
The governor of Kirinyaga.
You speak to the issues of the surrounding environment relating to the situation in which your doctors work in, yes?
Yes.
And you allege that, or you state that there are some asbestos roofing.
Yes.
Which hospitals are roofed with the asbestos?
The Kirinyaga Hospital and the houses.
The Kiregoya Hospital.
Kiregoya Hospital and the houses within the hospital that houses the health workers.
Has your union made any attempts to have that issue looked into or rectified?
Several times, especially after the arrival of the Cuban doctors, we realized that the Kenyan doctors have horrible housing. We tried to address it, but we could not get back any communication.
You speak in your statement at paragraph 8, you speak about reinstated 77 health workers, yes?
Yes.
When were they reinstated and who ordered or authorized their reinstatement?
During the strike, the governor had given us an olive branch that should the health workers go back to work, they'd be reinstated. 77 health workers went back to work in July last year, but their salaries were never paid up to date until on last Monday, the court gave the judgment to have the reinstated health workers be paid. They worked for almost a year.